Dementia is predicted to increase dramatically over the next 25 years. An Indigenous-led team of university and community-based researchers are working to transform brain health assessment and care.
Those assessments were built and developed with populations very different from our First Nation communities and Indigenous communities in general.
By 2050, Alzheimer's disease is predicted to increase by 273% in people with Indigenous ancestry, compared to an estimated 187% for the overall population of Canada.
Dementia itself is sort of an umbrella, an all-encompassing term for different challenges with neurodegeneration in aging. And so the most common form of dementia is Alzheimer's disease.
$24 million has been awarded from the Government of Canada's New Frontiers in Research Fund to develop dementia assessment tools that will be trauma-informed and culturally safe.
When you take the elder out of their home and you bring them into a strange environment, their behaviors are not what they normally present every day.
Researchers at McMaster University are collaborating with community organizations, such as Memazing North Shore Community Health Services, to engage directly with patients and caregivers.
Address the needs that were brought forward to us, and one of them really was to look at brain health and how our experiences as Indigenous people have been impacted.
The trauma many Indigenous patients may carry from unique lived experiences will be considered and accommodated in the project's work, including trauma from residential schools and other factors that can cause poor outcomes for patients, who then act out in negative ways as dementia progresses.
The main thing is people begin to have challenges with the way they're thinking, the way their cognitive processing works, and also with their memory. And that eventually, it's a progressive decline and eventually causes all sorts of difficulties in the way that they can function and remember things and communicate and even feed themselves and care for themselves.
The team will be working over the next 6 years to build tools that are culturally safe and trauma-informed to meet the unique needs of Indigenous communities in Canada and around the world. In Hamilton, Beverly Andrews, City News.